So I'm going to take you through an intense, detailed process of how medical checkup is done from step one to the last point. Exactly how is it done? Exactly what is it that you're supposed to know? So I want you to concentrate. Please relax, take a pen and a paper, note down these things that I'm going to talk about. When I finish, then from there, we can have a session where you can actually inquire anything you want to inquire. So please take note, be very serious on this, take the matter very, very serious because this could be your breaking point if you want to make good times, if you want to perform and make a difference in your athletics career, then this is something that you must know. This is something that nobody will tell you this. But behind the scenes, most professional athletes will always do it, and they do it and they know how to do it. But you might not access this information, but I'm here to ensure that you get this information. So please be serious about it and take note. I'm going to be as brief as possible. And for more details, probably we can actually have a talk on that. Now, this process involves checking your body. Is your body or your systems ready for any form of training and competition? Are you prepared for that? So before you step into the track, is everything ready? So the process involves this. When you come for medical checkup, we will start with the most basics. We will look at your height and the weight. Your height and weight is going to explain to us, number one, where are you? Are we having a situation where you are either underweight or you are normal or you are overweight or where exactly it is? So when it comes to athletes, it's a bit different from normal people. Normal people usually their BMIs will regrade it differently from an athlete. An athlete is because remember you might have you might be very bulky where you have a lot of muscles. Your BMI might come as if you're obese, but in reality, you're not. So we have a different way of grading athletes. After we look at your height and your weight, we now go in to look at the vitals. So what does the vitals involve? It involves your blood pressure. We want to see at your resting state, do you have high blood pressure or low blood pressure or normal blood pressure? This will indicate to us that in cases of intense training, your pressure, where is it likely to lay? Then we also look at your heart rate. How hard is your heart working to pump blood to all parts of your body? So when we look at how the heart is pumping, that is the heart rate, how many beats per minute at normal resting stage, it has its own significance. Then we also go ahead to look at your respiratory rate. How is your breathing per minute? How many times are you breathing? This is very important because it will tell us whether at resting place, at resting state, your lungs are overworking. If they are overworking, it is too high, then definitely when you go to compete, you're going to have a problem. We look at another very important thing. We check it very, very well is how you supply oxygen to all parts of your body, which is SpO2. This will inform us how your body is actually getting the oxygen. Is the oxygen you're breathing in getting to where it's supposed to get? Remember, when you're training and when you're running, you are using oxygen. It is an oxygen affair. You are breathing very heavily. You are at some point, especially sprints, we have an aerobic form of, but oxygen must. It's a must. So remember this, and put this at the back of your mind that when your oxygen levels happens to be below 90, and you go ahead to train, be rest assured you are actually destroying your brain tissues, your heart tissues, as well as your lung tissues. So you are simply making it worse when you step into the truck and already your oxygen supply is below the normal recommended check. As a sprinter, I expect you to be above 95, nothing less than 95. So SpO2, we have to look. So those are the vitals: respiratory rate, heart rate. We'll look at your SpO2 and your blood pressure. All of them will inform us a detailed information about you. That is basic. Now we go to the next step. The next step we look at is the systems. We look at your respiratory system. Do you have chest pains? Do you have chest sounds that will indicate a possible infection? Is it that you could be having pneumonia, bronchitis? Do you have any form? Do you have asthma? Remember, if maybe we get you have a form of asthma, we definitely expect that when you go to strenuous exercises with weather conditions that are not favorable, you're likely to suffer from what? Asthma, acute asthmatic attack. And if that happens, then you're not going to perform. So this will tell us how to prepare. Remember, again, you cannot go using drugs to help your asthma without considering that we have the anti-doping agency that is actually on the neck of every athlete that destroys their reputation. So if, for example, you are suffering from these conditions, I need to give you a letter for that. We need to communicate that you are on certain drugs. We look at your cardiovascular system. Do we have a challenge with your heart? How is your heart? So, how is the cardiovascular system working? Remember, this is the system that is responsible for distributing blood in all parts of your body to ensure that you get enough oxygen to all parts of the body. If the heart or the cardiovascular system has a problem, then I definitely expect that that problem will translate back to the truck. So we need to correct that. We look at the gastrointestinal system. The gastrointestinal system, what exactly are we looking at? We're looking at your organs. The liver, is it swollen? The spleen, the pancreas, the kidneys, are they in the normal sizes? If they are swollen, we go ahead to look at them. We find out, why are they having a problem? Why do you have a swollen liver? Is it that you have hepatitis? Why is your kidney not okay? Do you have a kidney problem? Do you have a system that is not fine? So we look at your abdomen. So we do look at the examination of every part of the abdomen. That is the gastrointestinal system. Then we go to genitourinary system. We look at your system that actually clears urine from the system. So this is a system that is responsible for clearing toxins in your body. So if this system has a problem, remember, as an athlete, you will use a lot of supplements, you will eat a lot of things, you will undergo a lot of training. So this will actually overweigh your kidney. So if the kidney is not at the right state, we're going to have a kidney failure at some point. So before we go into kidney failure, we have to ensure that your kidney is the way it's supposed to be. If it is not, we correct it. We go ahead to look at the nervous system. This is the most fundamental system in the body. This is a system that will ensure your muscles are working. This is the command center. This is what is actually going to help you execute your programs. So we look at the nervous system. Is the power okay? How about the reflexes? Is it responding well? Once we're done with the nervous system, we now go to musculoskeletal system. This is your muscles. How are your muscles? We look at every single muscle. How is it? What is the state? What is the level? What is the standard of function? Is it functioning the way it's supposed to? It involves measurements of even the height of the leg, the sizes of the thighs, sizes of the gastrocnemius, sizes of the soleus, and the quads, every single bit. We look at if there is an imbalance. This is where we pick your injuries, we pick the tight bands, we pick all kind of shoulder problems, hands, everything. So if the muscular system has a problem, we pick it from there, and that's where the recommendation of the physios will come in. That's where we will now come to start correcting what is not right. We look at every single detail of your musculoskeletal system. Then after that, we now look at the coordination, neuromuscular coordination. Your muscles, are they responding to the nervous system? When the nervous system commands, is your muscle picking it the way it's supposed to? Remember at the gun point where you get the gunshot, is it the gunshot at the start point? It is the coordination. Remember, even when you are sprinting, it is the coordination. Neuromuscular coordination is what will be required. So we're going to look at it carefully. Now we are examining to look at it physically. How is it behaving before we now go to investigate it further? So having checked that, then we go to the next process. So we have reviewed the systems, we have looked at your vitals, we have checked every single thing. Now we go to the next process, which is now the investigative process. Now, the investigative process is very intense, and I want you to stay in tuned because this is where everything becomes handy. We look, remember, I told you very, very well, sit and relax, learn, get to understand, get this information right. Once we get it right, trust you me, something is going to change in your career. So let's go now to the next process. So the next process involves lab works. So lab works are what now makes the whole difference. So what lab works are we checking? We first of all do what we call complete blood count. We also call it full hemogram. This informs about your blood. How is your blood? We look at your white blood cells. White blood cells, the importance is to check if we have an infection. And it will also tell us, is the infection bacterial or is it viral, or do we have an allergy going on? Do we have, so different types of white blood cells we'll be able to see through these tests. We also look at your red blood cells. We look at your hemoglobin levels. We look at the blood indices. When we say hemoglobin and blood indices, what will they tell us? Do you suffer from iron deficiency anemia? Or do you suffer from a type of anemia that we need to look at? Is it a B12 anemia? Do we have a problem when it comes to the supply of oxygen to your body? This test will tell us. It will also tell us about your platelet levels, that in case of an injury, are we at risk of bleeding? And remember, if you are exposed to extreme exercises, anything can happen. So is your blood ready and at a state where everything can come back to normal, or do we have a concern? Then after we check your complete blood count, we go ahead now to do what we call renal function test. Remember I told you about the kidney. Now we look at the kidney in the lab. The kidney is responsible for clearing toxins in your body. As an athlete, as I said, you're going to consume a lot of things. So, how is your urea levels? So, urea will tell us, is the kidney okay, or do we have a problem? We will check your electrolytes using the kidney. Potassium and sodium, very important electrolytes. We must have a balance of these electrolytes. So we must look at them. I'll come to discuss about electrolytes later. But we also need to check about creatine. Remember, as you're exercising, this breakdown of tissues and all that, you create a lot of creatine in the body. Is the kidney clearing this creatine? And remember, athletes, that you even go ahead to consume creatine. What is the effect of this creatine that you take in the kidney? Is it able to clear it from the system, or it's accumulating in the system and causing problems? So these are the things that we look at in the renal function test. Then from there we go to profiles. Profiles, we have what we call hormonal profile. What hormone are we targeting? As a sprinter, a male sprinter, we need to know about the levels of testosterone. You cannot compete with somebody's testosterone if they are high and you have low testosterone levels. We look at the cortisol levels. Once we look at the cortisol, for females, we'll also look at estrogen and progesterone levels. Remember, for females, the lower the estrogen and the higher the testosterone for you, the better. You are able to compete very, very good. This is where the game comes. This is the where everything changes. So for a male, if your testosterone levels are low, be rest assured you're going to have a hard time with the males who have very good levels of testosterone. Cortisol levels, very, very key and important. We're going to discuss about these things. Today, I want you to note down that these are the things we look at. We also look at lipid profile. Lipid profile involves what? Total cholesterol. How is your cholesterol levels? The bad and the good cholesterol, what you call LDL and HDL. We also look at triglycerides. Very important for us to know what are your cholesterol levels. Remember, we have a lot of damage that comes. Sometimes you can have an imbalance where the bad cholesterol is more than the good cholesterol. This will cause a lot of trouble to you. Now, we go ahead to investigate further. We look at your liver. How is your liver functioning? So we look at liver function test. Any form of allergy, any form of reaction, any form of remember, the liver is very, very key when it comes to now the metabolism of the glycogen, the production of several things. The liver is key. It is one organ that works very, very much to keep you in your training. So we look at it. Is it in the normal state? Now, from there, we go ahead to look at your urine. We do analysis of your urine. How is your urine? Remember, this urine will be checked. Even for your doping, everything, we look at the urine. Urine tells us a lot of information. So once we clear, we check your urine and we do what we call urine analysis. We go ahead to look at your stool. Do we have any ova or cyst of an organism? If you have amoeba, for example, it is going to catch up with you. You're going to have abdominal issues, diarrhea, abdominal pains during training. It's going to derail your functionality. You're not going to be able to absorb what you're eating, and you're not going to be able to execute exactly what you're supposed to do. If, for example, we get you with hookworm, hookworm is one of the worms that causes anemia. It sucks your blood. So your iron levels keep dropping down. You will never perform if you have hookworm. So these are the things we look at. So when we get you with hookworm, we now know, or any other form of parasites. Parasites in the abdomen will always cause a problem. So we need to look at this athlete. Does he have anything that is likely to cause problems at the end of the day? After we look at your stool, we now go ahead to look at your blood sugar levels. Do you have high blood sugar levels? Are you diabetic? And if you're diabetic, what type of diabetes? Is it type 1 or is it type 2? This will inform us what diets for you. This will inform us that you need to do. So this will help us guide you in terms of what you're supposed to do, what you're supposed to feel as an athlete, because this is a special case. Then we look at, remember, the blood sugar levels will also tell us whether your sugars go low, where you have low blood sugar levels. So that is very, very important. After we check that, now we go ahead to look at your minerals. We look at your calcium levels. We look at your magnesium levels. We also look at the zinc levels. When we check these minerals, we are targeting specific things. Each and every one of them is very important when it comes to the contraction and relaxation of muscles and the balance in the body. We go ahead to look at B12. We look at D3. Very, very important in your system. If one is off, it will catch up with you. Believe me or not, it will catch up with you at some point. So once we check on that, we also go ahead, we will look at possible state of parasite infection like malaria and HIV and AIDS. Why HIV status? Is because if your HIV is not well controlled, you develop what you call opportunistic infections, which are going to derail you when you are at your peak. You're not going to be able to train well. Your diet is going to be actually different from the others. So when we get you with HIV and AIDS, that does not mean you cannot sprint. That does not mean you cannot compete. You can very well. The only thing is you need to look at what you're supposed to do, because what you are required is different from all the others. So after we look at this lab test, now we have the results. We now go to the level of discussing the correction. How do we correct this? So I want you to stay tuned so that I take you through the next process, whereby now we look at the next process to end our medical checkup. That is very, very important, because now this is where you come to execution. So correction will involve several things. One, it is a team. And when I say it's a team, is we will look at your results, the lab results. We'll look at the examination that we did. We'll also look at the vitals. Every one of these will now guide us to the conclusion that, let's say you have a neuromuscular issue where one muscle is causing compensation to the other. So this will require who? A physiotherapist. So here comes now the team. What team do you need? Number one, sports nutritionist. Number two, physiotherapist. Number three, a sports medicine doctor, like I am. So this team will help you. Now, I have forgotten one very, very key person who is now the coach, the trainer, because this is the bearer of the program. He has to understand your state and the report that we will give. And that's why we advise on managers, because a manager will be able now to coordinate all of this. Now, the coach takes control of everything. You are eating, you doing every single thing. It's the coach. So what we do is we are support systems of you as an athlete to the coach. So once we have a sports nutritionist, he will look at, we'll advise now. I now, as a sports medicine doctor, I will come in and say, like, you know what, we have a deficiency in B12. So every single diet should go there. We have a deficiency, or your levels of testosterone are low. Your diet should be able to go to and improve your testosterone levels. We look at your D3, it's low. Now, where a medicine is required, I will come in and do a prescription. If, let's say, you have an infection that is coming in, if there is an imbalance that needs to be done because of 1, 2, and 3, we have damage to the nervous system. There is medicines that I'll prescribe, and then it is seconded by physiotherapy. It is seconded by sports nutritionists. They go hand in hand. And always now you go to the field and we give recommendation to the track that, you know what, this person, we require that he goes rehabilitation maybe for a period of 2 months or maybe a period of 60 days, and he will be back to normal. But if he continues this way, we're going to have a problem. Now, anytime this is not given to you, you end up into a track and develop a problem. So you come back now with a problem that could have been fixed even before you started. So having taken through all that, now it is time for you to take action. Get to understand this, that when you have your checkup done, trust you me, you will know what is the state of your body. Sometimes you struggle a lot in the track. You're running, you're breathing so heavily, you're getting fatigued very fast, you have a lot of pain, probably sometimes headaches, you have diarrhea at times. All these kind of problems, it is something that is just very simple to correct. And you could have missed a very simple, and this one will cost you your performance, a time that is supposed to be reduced, it becomes a problem. So when we look at this medical checkup, we look at your neuromuscular system, we look at your nervous system, we look at all the other systems. They are the systems that you're running as a human being, and everything has to be on point before you start competing, before you start training. If something is out of balance, it's out of a way, then definitely you cannot. And I usually say a medically fit person, a medically fit athlete can actually compete very well. And if you are unfit, you cannot outdo a medically fit. It's just a matter of time. So, regardless of how good you are, you must be medically fit for you to compete. Otherwise, as simple as diarrhea can stop you from running. A headache that is not disappearing can stop you from running. You run, you feel the body is going flat, no energy, no nothing is a problem. There's a problem. Electrolytes probably are off. Probably your kidney is not clearing things from the system. So definitely we must have a look at that. So having taken you through that, I hope you're going to take action. And if you need any help, do not be scared. Just reach out to me. I'll be able to assist you in the best way possible. I am very, very approachable. Just talk to me and I'll be able to help you. Thank you very, very much.